this episode of The Debunk, we look into the COVID-19 vaccine and debunk some of the misinformation around it. My name is Mariana Pio, and welcome to The Debunk Show. First, what are the chances of getting COVID-19 after being vaccinated? We did some research. Whereas the vaccine itself cannot give you the virus, it is also not 100% effective at preventing you from getting the virus. Whereas 95% of healthy individuals have higher chances of producing antibodies with the vaccine administered, Center for Disease Control and Prevention, CDC, released guidelines cautioning those with compromised immune systems to, one, get the vaccine, but pay attention to the potential of reduced immune response to the vaccine. The topic of the vaccines has become very crucial, especially during the second phase of the virus in Uganda.
Many people have turned up at the Ministry of Health to receive their COVID-19 jab as the second wave hits the country.
So many growing myths and misconceptions that are making very many individuals forsake the procedure. In an article by the Daily Monitor on Wednesday, 21st April 2021, more than 280,000 doses of COVID-19 vaccine would expire before being used if vaccination continues at the current rate. On an online platform called Our World in Data, there is a record of 569,000 people who have received at least one dose of the vaccine in Uganda, and at least 4,129 people who have fully been vaccinated as of 28th May 2021. We also engage with Professor Nsofo from Nigeria, and here is what he has to say about the vaccine expiry.
What we really need to do across countries on the continent where this expiry or soon to be expired vaccine is an issue, we really need to mobilize for people to come out and take the vaccine. Yep. And I think that we've also gotten to the stage where we don't have to wait for the people to come. We can take vaccination to the people. There are different, places where people meet within communities, associations, whether it's in churches. I know in Nigeria, we've done that, taking vaccination to churches so that as people are coming out of church, they can be vaccinated. So we need to think differently to make sure that the remaining weeks or months that we have before this vaccine expired, that people at least will take them as quickly as possible so that we don't get to the vaccine expiring. But if per chance the vaccines expire, despite everything that we do, my recommendation will be let us not ask people to take it after that, because it is not going to help us at all.
We spoke to a medical expert, Dr. Brian Serunjeji from Newcastle, and he gave us facts regarding expired vaccines.
Drugs and vaccines have expiry dates to remind the user, who is a patient, and the healthcare provider who is administering or giving this drug to the patient, that beyond this date, the medication or the vaccine may not work as it's supposed to be, because either the ingredient has become its effectiveness died off, or it has changed into something which is not effective, or which is not going to treat what it is intended to treat. If, for example, you're expected to be protected from COVID after getting the vaccine, if you get an expired vaccine, then chances are that you won't get as enough protection as you should have had with a real viable vaccine. But also, it's not that on that day or that month, it just falls off the cliff and then goes to zero straight away. May go down over a certain time, but to avoid confusion, you don't want to tell people that you can still use it for this long, because it can cause a lot of confusion. Seen in the WHO I don't know how long ago, said that the vaccines may still be effective after 3 months. I think they're also trying to find out more. I think what they said is that the countries that have prepared these drugs or the vaccine should not throw them away. Hold on to them, and then they'll find out more information whether they'll be still valid or not to use.
In a joint press release by World Health Organization, Ministry of Health, UNICEF, and the COVAX facility in Uganda, Uganda received 864,000 vaccines in March. The target was to vaccinate approximately 43.8 million Ugandans, which are 20% of the population. Is it because of all the above reasons and the many roaming misconceptions about the vaccine that many people are very skeptical about being vaccinated? These are the facts that we have gathered from a report by World Health Organization, Ministry of Health, USAID, and UNICEF. 1. COVID-19 vaccines are designed to teach the body's immune system to recognize and fight the virus that causes COVID-19 virus. 2. AstraZeneca vaccine was rebranded COVAX vaccine here in Uganda, and all individuals aged 18 and above can get the vaccine free of charge. Lastly, even after recovering from COVID-19, one still needs to get the COVID-19 vaccine. Healthy individuals and individuals with compromised immune systems should continue to follow the public health guidelines even after being vaccinated. For more of these facts, subscribe and check out the Media Challenge YouTube channel, and also follow us on Twitter and Facebook at Media Challenge Initiative. My name is Marina Pio. Until next time, stay verified.